How are
Hi,
you today?
I am doing fine.
Yeah,
Thank
my
you.
name is Victoria and I'm a registered nurse and I'm here to do your health assessment. Can you tell me something a little bit about yourself?
Well, um, of course, I'm 57 years old and I work full time as a physical therapist assistant, and I'm fairly active. Um, Currently, now I'm not have any real health issues at this time, um, but I want to do my regular. I want to know how I'm doing and do some regular checkups.
Okay. Um, Tell me something about your childhood illness. Have an illness during your childhood?
Um, well, yes, I had pneumonia as a child, and I also was hospitalized for that. Um, I also had a dislocated wrist. I fell um, and dislocated my wrist, so I had to have a cast on. And most of my childhood is just regular colds and things like that. No real serious illnesses apart from the pneumonia.
So do you have like any allergies or anything like that?
Well, currently I do have allergy to erythromycin, the medication. When I take that, I have pain in my groin area.
Um, what it's like your eating habit. What's your eating habit?
Well, I do eat regular, like 3 meals a day. I have no problem eating, and basically I eat whatever I want. No restriction with eating.
Okay. Do you drink alcohol?
No, no alcohol.
Okay. Any? What about your intake, like salt or sugars? How
Salt
much?
is like medium. I take not a whole lot of it, but just enough to give my food taste, and I try to cut down on the sugar.
Okay. Do you smoke?
No,
No tobaccos?
no tobacco.
Any drugs like street drugs?
No,
Nothing like that?
no.
Okay. Um, are you sexually active?
Yes.
Okay. And any illnesses, like any sexually transmitted illnesses like
No,
HIV?
no,
Your personal safety. Do you live alone?
no, no.
Okay. Any falls? Like frequent falls?
No, I've never, no falling. No.
Do you have any problem with your vision or anything like that?
Well, no real problem. Of course, I wear glasses because I need my glasses, especially when I'm driving, so I can see far away to read the road signs. But I can read without my glasses.
Okay. What about your hearing? Any problem?
No problem with my hearing.
Okay. Um, what are your advance directives? Like, what would you like to happen in case you cannot speak for yourself?
Well, I'm married, so my wife would be the one who would take care of anything that I need if I'm not able to represent myself.
Okay, so if anything, your wife, we could share information with your wife, okay?
Certainly,
All
yes.
right, thank you so much. Um, Tell me about a little about your family history. Um, any significant health problem like with your father?
Well, no, I know that, well, he was probably an alcoholic because he drinks a lot. He loved to drink and smoke. But apart from that, uh, shortly before, of course he's deceased now, but shortly before that, he had a stroke and had treatment for that. He had therapy and was able to walk with a cane. And so no other illnesses as such that I know. And for my mom passed away, and she had colon cancer. But apart from that, no other illnesses that I know of.
Okay. All right. Let me ask you a few questions right here about your mental health. Is stress a major problem for you?
Oh, not at all, no.
Okay. Do you feel depressed?
No, not at all.
Do you panic when stressed? When
No.
there's any stress?
No.
Do you have any problem with eating or your appetite?
No, not at all.
Okay. Do you cry frequently?
No.
Do you ever attempted suicide?
Oh, no.
Have you seriously thought about hurting yourself? Have you ever?
Never, no.
Do you have trouble sleeping?
No.
Okay. Have you ever been to a counselor?
No, I've never been to a counselor.
Okay. Alright. Do you usually get up to urinate during the night?
Usually, yes. Sometimes 2 times and at most 3 times.
Okay.
Yes.
Do you feel any pain while urinating?
No pain at all,
Okay. Any blood in the urine?
no. No, no.
Any discharge from the penis?
No.
Have you ever forced your urination decrease?
The
As-
force
as
of
the
the...
force of the urination decrease?
Yes, I noticed that, and that's something that I think happened gradually as I get older.
Okay. Do you have any problem emptying your bladder completely?
No, no problem.
Okay. What was the last date of your prostate or rectal examination?
I had one about 2 years ago.
Okay.
Yes.
Okay. All right. So far, you've been doing pretty good in your assessment. What about your skin, your nails, and so forth? Any problem with your skin and nails?
Skin looks pretty good. I have on my nails sometimes because I'm out in the yard, the garden a lot. Sometimes my nail changed color, and I was taking something for fungus for the nails. So it's clearing up though.
Okay. Okay. Any pain in the neck?
Occasionally, there are times when I have pain, and so I would take Motrin or just try to use hot compressors for it to help the pain, or massage.
Okay. So definitely today. So why are you really here today?
Well,
What problem do you have that makes you want to come to the doctor today?
yeah, well, currently, I feel pain in my neck because I had a surgery on my neck, the cervical discectomy. So occasionally, and especially if I sleep on a pillow, then I have some soreness in my neck.
Okay. And we know that the coronavirus is very rampant in our community and overall global today.
Yes.
Are you taking like any precautions?
Yes, well, I follow the social distance, and of course, when I go out in the crowd, I wear my mask. I try to drink a lot of water and take vitamin C to help keep my body, my immune system in good shape.
Okay. All right. That sounds good. Yeah. Thank you so much, Mr. L. Thank you so much. And I'm very happy to have you here today, and I'm glad that you could express your health history and tell me more about yourself. And with all the history that we have, that would, like with your diagnosis today, your doctor can clearly, evaluate you. All right. Thank you so very much for coming.
You're quite welcome.
All right.
Thank you very much.
You're welcome. Thank you.